Welcome to the assessment of the gastrointestinal and genitourinary systems. This program is offered by the Beacon Institute and was made possible with a special grant from the Maryland Office of Healthcare Quality. This program should enable you to list the age-related changes associated with the gastrointestinal and genitourinary systems. Describe the components and techniques used in the assessments of these systems. Identify and discuss abnormal assessment findings. List nursing diagnoses associated with GI and GU disorders. And discuss measures to assist residents in achieving optimal GI and GU function. The function of the GI system is to consume, digest, and absorb nutrients, as well as to eliminate the waste they produce. The GU system includes both urinary and reproductive organs. The urinary system filters blood to remove water and chemicals that could harm the body if left to accumulate. The reproductive system enables sexual function and the creation of new life. The parts of the GI system include the mouth, through which food enters and begins the preparation for digestion, the esophagus, which carries food to the stomach. Muscle contractions push food along the esophagus to the stomach. The stomach has acids and enzymes that break food down. Food then reaches the small intestine. Most digestion occurs here, as well as the absorption of nutrients. Bile and enzymes from the liver, gallbladder, and pancreas aid in this process. Substance from the small intestine is mostly liquid. Water has to be reabsorbed, which is done in the large intestine. The solid waste which results is stored in the rectum till eliminated through the anus. Aging does impact the GI system. Taste sensations are altered. There is a particular loss of taste buds for sweet and salty flavors, which often causes older adults to complain that food doesn't taste right. Thirst sensations are decreased, which increases the risk of dehydration. Chewing problems impact sufficient intake and/or the preparation of food for digestion. A weaker gag reflex can lead to swallowing problems and increase the risk of choking. There is decreased stomach acid, causing problems breaking down food. This can result in bloating, belching, and indigestion. There's a weakening of the cardiac sphincter, causing reflux. Food and stomach acid go back into the esophagus. Although there is not much change in the small intestine function, there may be decreased lactase leading to an intolerance of dairy products. Waste remain in the large intestine longer, causing more water to be absorbed. This results in the stool becoming harder, leading to constipation. GERD, or gastroesophageal reflux disease, inflammation, ulcers, cancers, diverticulosis and diverticulitis, and hemorrhoids are some of the common GI problems that occur with age. The urinary system normally functions to filter and eliminate waste. Blood circulates through the kidneys where the glomeruli within the nephrons filter out waste. The ureters carry urine from the kidneys to the bladder where it is stored until the person is ready to void. The urethra carries the urine from the bladder to the outside of the body. Here we can see the contrast between what we need for proper function of the urinary system and age-related changes that can affect that function. To summarize, older people are at higher risks for dehydration, problems with bladder emptying, increased frequency to void, and possible leakage of urine. Incontinence is not a normal part of aging, but may result from problems with nervous system control, as well as with cognitive and functional impairments that impact a person's ability to toilet themselves in response to the urge to void. There are some gender-specific issues that may arise that can contribute to the blockage of the urethra. For men, the enlarged prostate, BPH. For women, the risk of leaking urine due to weaker sphincter muscles and prolapsed bladders. As noted in the beginning, the GU system includes reproductive organs and processes as well as urinary. For women, changes are directly related to changes that occur with menopause. For men, changes are not as drastic but occur as a gradual decline. Now let's talk about assessing these systems. These lists are not all inclusive, but show some of the more frequently occurring problems related to the GI and GU functions. Note that diabetes and Parkinson's show up in both lists. Damage to the nervous system can potentially result in delayed emptying of the stomach, decreased sexual response, including male erectile dysfunction, bladder dysfunction, poor control of sphincter muscles, and increased frequency of urinary tract infections. This slide shows how diabetes affects the GI and GU systems. Among the problems that can develop are nausea, unusual weight gain or loss, urinary frequency, poor renal filtration, and vaginal infections. The shaded area in the diagram in the upper right shows parts of the body under the influence of the autonomic nervous system. Diabetic neuropathies can occur within the autonomic nervous system, which controls much of the GI and GU systems. Parkinson's disease also affects these systems, potentially causing swallowing difficulties, constipation, urinary frequency and urgency, erectile dysfunction, premature ejaculations, and the inability to achieve orgasm. Although cognitive and physical functioning don't involve the GI and GU organs, problems in these areas affect the toileting process. People with dementia and delirium may not recognize the need to toilet or be able to find their way to the bathroom. Depression can cause people to lack the motivation or energy to go to the bathroom. The use of some of these medications tell you about the GI-GU problems that the person has experienced. For example, the use of laxatives tells you the person has problems with constipation. Many other medications have an effect on GI and GU function. DIG toxicity can cause GI upset, diarrhea, and can also impact the electrolytes and renal studies. Please refer to the handout Medications Affecting the GI and GU Systems that is in your toolkit for more information. Your assessment should include a review of symptoms. These are common symptoms associated with the GI system. As noted by the asterisks, check these symptoms to their relationship to food intake. These are symptoms of problems associated with the GU system and some of the questions for you to consider asking if they are present. Try to obtain as much description about the problem as possible. Remember, incontinence is not normal. If it is present, explore the causes, which can be helpful in establishing the plan to restore continence. Incontinence not only has physical ramifications, but psychosocial as well. There are various types of incontinence. Stress incontinence is one type that is common in older adults. Women may develop this as a result of weakened pelvic muscles from childbirth. To test for it, offer the resident fluids, and when the bladder is full, have her stand or sit upright. Place a 4x4 between the legs and have her cough vigorously. Then check the 4x4 for wetness. Kegel's exercises helps to strengthen pelvic floor muscles and improve bladder control. Urge, overflow, functional, and mixed are additional types of incontinence. Most nursing assessment tools in long-term care do not include an area for sexual function, which implies that long-term care residents are no longer interested or able to engage in sexual behaviors. We should at least ask if this is something that concerns them, as if it is of interest or concern, we may be able to provide the information or resources to help. We start the physical exam part of the assessment with observation and impressions. As you recall, our sense of sight, hearing, touch, and smell are used in the assessment. Odors may tell us something about GI/GU function. Observation should include inspection of the mouth. Be sure to remove dentures so that you can fully examine the condition of the gums. As you can see, there are a variety of problems that you can note in the mouth, ranging from broken teeth or patches on the tongue to sores on the mucous membrane. If problems are present, ask about the discomfort or pain associated with them. Begin your assessment of the abdomen by inspecting it. Does the contour indicate the presence of ascites? Look at the contour from more than one angle, for instance from the side and then again from the foot of the bed. To check for a hernia, have the person lift his head off the pillow, hold his breath, and bear down. This will help hernias to be more visible as it increases intra-abdominal pressure. As noted, auscultation should occur before hands-on touch to determine bowel sounds before manipulation. Manipulation can stimulate peristalsis, which will skew your findings. Using the diaphragm part of your stethoscope, listen in all 4 quadrants for bowel sounds. You should hear soft clicks and gurgling noises every few seconds, approximately 5 to 30 noises per minute. Move through all the quadrants in a clockwise direction. Hyperactive sounds are rapid, more than 30 a minute, and high-pitched. Hypoactive sounds are infrequent. Bowel sounds are considered absent if no sounds are heard after listening for 2 to 5 minutes in each quadrant. You can use the bell portion of the stethoscope to listen for bruits while doing the abdominal assessment. You can listen to the aorta just above the umbilicus and check the renal arteries on the upper quadrants of the right or left of the midline. You can also check the iliac artery just below the umbilicus and the femoral in the right and left groin area. Percussion of the abdomen follows. To percuss, place your middle finger of one hand flat on the abdominal surface and with a regular motion from your wrist, use the middle finger from the other hand to tap against it. A high-pitched sound known as tympany indicates gas, while dull sounds mean you are percussing over solid matter. Because of the position of the liver, the right kidney is lower than the left. Normally, you're probably not going to be able to feel the left kidney unless it's enlarged for some reason. The costovertebral angle is where the last rib meets the spine. When percussing in this area, use only a gentle tap. As noted, palpation should be the last part of the abdominal exam. It may help the person to help relax the abdomen by raising his knees with his hands at his side. Light palpation is used to assess superficial organs or masses. Deep palpation assesses deeper organs and should only be done by those with advanced practice skills. Part of the exam of the genitourinary system includes examining the external genitalia. Note unusual swelling, bleeding, lumps, discharge, and hemorrhoids. We can also learn from assessing the urine. Note color, clarity, and odor. Test for specific gravity and pH. As this slide shows, findings in the urine can indicate specific health concerns. The shape and consistency of stool tells us something about bowel function. In looking at this stool chart, types 4 to 6 should be the goal, with 5 being the ideal. The color is important as well. The brown-green color comes from bile. Black stool usually is indicative of bleeding, especially if tarry and foul-smelling. Clay color is from the lack of bile, which indicates a liver problem. Some findings are important to report in a timely manner. These include oral pain and discomfort, lesions and discolorations, choking and difficulty swallowing, a change in appetite, decreased food or fluid intake, several episodes of vomiting during one shift, a sudden onset of abdominal pain, distension, or tenderness, acute onset of diarrhea with a change in vital signs or level of consciousness, constipation, fecal impaction, or persistent diarrhea, new episodes of bleeding, new urinary or bowel incontinence, fever, other GI or GU symptoms, any new symptom arising after the administration of a new medication, ostomy complications, and abnormal labs. Be sure to include a nursing assessment of related signs and symptoms. Pay attention to lab results, which can tell us much about nutritional and hydration status. CBC is a broad screening that gives us information about anemia and/or infection. Iron is an important part of hemoglobin, which carries oxygen in our blood. If there's not enough iron, we can't make enough hemoglobin. Transferrin binds with and transports iron. Folate is a protein that helps to make normal red blood cells, DNA, and other genetic material, and helps the cells divide. Vitamin B12 is also needed to make DNA and helps metabolism run smoothly. Serum albumin reflects nutritional state, for instance, not having enough protein, and can also reflect problems with kidney or liver disorders or inflammatory bowel disease. Surveyors will expect to see aggressive action if the albumin is 3 or below. Prealbumin has a shorter half-life, so it can reflect a change in protein status more quickly. The kidney helps to maintain a constant concentration of electrolytes in our body fluids. Electrolyte levels will be affected by hydration status, and it can increase with dehydration because they will be more concentrated with the reduced fluid. BUN measures the nitrogen in the blood and comes from the breakdown of food protein. BUN levels can rise from a high protein intake, dehydration, or heart failure. Liver disease can lower the BUN level. Creatinine levels show how well the kidneys are working. High levels can mean the kidneys are not functioning as they should. As dehydration is of high risk to residents, it is helpful for you to be alert to the signs of this problem before the labs confirm it. These signs can include fatigue, dark urine, sudden lightheadedness, an increase in heart rate, overheating, muscle cramps, constipation, skin that has lost its elasticity, and thirst. Assessment is the first step of the nursing process. After assessing, you identify problems and form a nursing diagnosis or problem statement for each. The statement should include what the problem is related to, such as dehydration related to diarrhea or weight loss related to insufficient intake due to depression. You then develop interventions to address the problem. The actions should be tailored to the specific problem and its unique causes. For example, offering fluids more frequently will not necessarily benefit the resident who's dehydrated due to diarrhea as much as correcting the underlying cause of the diarrhea. A plan to assure good hydration is useful for every resident. Be sure to evaluate the effectiveness of the care plan and make changes as needed. Thank you for participating in this program. Be sure to review the handouts accompanying this presentation. If you have any questions, please consult with your staff development instructor or charge nurse. Thank you.